How about the turbinates? Inside the nose, there's these three little mountains on each side that are turbinates, and they provide a surface area to warm the air as we breathe, to humidify the air, and filter out some things. Now, what do you do if a turbinate is too large?
So usually we want to make sure we've talked about allergy therapy, whether that be a nasal steroid or a nasal antihistamine, an over-the-counter oral antihistamine, maybe even allergy shots. We want to make sure we've talked a lot about allergy because that's a common cause. And oftentimes when somebody comes to see me thinking that they're going to end up needing nasal surgery, it's as simple as controlling their allergies with medical interventions. And so sometimes we don't need to do anything for the turbinates, but when we failed those interventions, when somebody continues to have symptoms, then we talk about, okay, what needs to be done next? And then we talk about structural changes. So the turbinates are actually filled with blood. That's what allows them to swell. And so the turbinates, the structure, the bony structure, doesn't usually need to be messed with. What we're trying to do is reduce their ability to swell. And this is something that we most often, when we're doing just a turbinate surgery, we most often do this in the office, awake with local anesthesia, meaning topical numbing medicine.
So you spray the nose with topical numbing medicine. You know where the turbinate is. Well, what do you do to it? Do you squeeze it? Do you tear it out? What do you do?
So you use a small camera so that you can see inside of the nose and traumatize the tissue as little as possible. And then there's two primary techniques. One is a little needle that heats up with radio frequency energy, and it just from the inside out more or less cooks away that tissue. The other is an instrument that goes in and physically removes that little matrix of blood vessels. So it kind of smooths it out. And both of those give the body less of an opportunity to be able to swell and fill the nose up.
So when you use the little needle in there and you heat it and it causes some trauma there, swells it first and then scars down?
Correct.
Good results with that?
Excellent results. Both the techniques have very similar results. Different surgeons have different preferences, but both of them are really good ways to improve the nasal airway in somebody that's been identified correctly as having turbinates as their primary problem.
So you can see these turbinates by x-ray. You get a CT scan, you can tell what the turbinates are doing, and you can see them by physical exam.
Correct.
So you should be able to get a pretty good idea of what you're working with. Can you decide how much you need to shrink it? Because some are larger than the others.
That comes with experience and with doing this a lot and with thinking about kind of that patient. How's their nose? How narrow is the actual opening of the nose? How long has this problem been going on? And so, yeah, it's a little bit of a judgment call, but usually we can make the right judgment and get people good improvement without the danger of resecting too much or removing too much of the turbinate is that the nose can get overly dry. And so that's the thing we're trying to avoid.
So somebody can have a crooked nose and a turbinate that needs to be reduced in size both at the same time.